Hi, y'all. I'm going to be speaking about how racism affects the brain. This is Neurobiology, and it is 12/9/2025. So, first, we have our table of contents, and it'll be 11 slides that we're going to be going through. So, first, we're starting off with the background on racism. Racism has been going on for many decades. It is seen in many areas of life, such as society, the workplace, schools, and in healthcare. The stress that comes with racism and microaggressions has brought the African American community significant health conditions and physiological stressors. Constant exposure to racism and discrimination causes anxiety, mood disorders, PTSD, and potential use of alcohol and substance abuse. What is anxiety and its symptoms? Anxiety is a feeling of worry or fear in response to stress. It becomes a disorder when it becomes excessive and it interferes with our daily life. Sometimes symptoms cause a disruption in work, school, or our relationships. Mental or emotional symptoms look like feeling of nervousness, restlessness, feelings of being in danger, irritability, difficulty concentrating, or an urge to avoid things. Some physical symptoms look like increased heart rate, rapid breathing, sweating, fatigue, trembling, or an upset stomach. Anxiety on a deeper level. When anxiety is present in the brain, the oblongata becomes overactive and it triggers our fight or flight response. This happens via the hypothalamus. When this happens, the body's stress hormones like adrenaline and cortisol can rise to unsafe levels. As hormones rise, our prefrontal cortex cannot do its job of rationalizing and making good decisions. We are in a state of high alert, have racing thoughts, and have difficulty concentrating in those moments. The hippocampus is our center for memory control, and when anxiety is present, it does not work properly and it brings up past negative experiences once we're triggered. Medication management for anxiety. So, medication for anxiety are called selective serotonin reuptake inhibitors, also known as SSRIs. These are first-line treatment for long-term management, and this increases serotonin, which can decrease our anxiety. Examples of these medications are called Zoloft, Prozac, and Lexapro. We have other medications called serotonin norepinephrine reuptake inhibitors, also known as SNRIs. They're also first-line medications, but they focus on the norepinephrine. And examples of those are duloxetine and venlafaxine. And those medications are on a case by case basis. So your provider has to examine you and see what medications are best for you. Because there's also medications called benzodiazepines, also known as benzos. And those are fast-acting medications and they're given, but they're only given to patients who experience severe short-term anxiety or panic attacks because these medications are not meant for long-term use because they have high potential to carry out addiction and other medications that may be used for long or short-term use are buspirone, beta blockers, which are also known as heart rate management medications, and antihistamines, which are situational anxiety, which is again, your provider needs to examine you and it'll go on a case by case basis. We also have mood disorders such as depression. Mood disorders like depression are a state of mind that takes over one's emotional state, and this ranges from severe sadness to extreme high moods, also known as mania. This condition has the ability to impact daily life in ways such as sleep, energy, and interest in activities. The different types of depression include MDD, which is also known as major depressive disorder, MDBD, which is also known as major depressive bipolar disorder, persistent depressive disorder, and seasonal affective disorder, also known as seasonal depression. Mood disorders on a deeper level. When depression is present in the brain, the hippocampus has the ability to shrink, which is the cause for the memory problems when depression is present. The prefrontal cortex is responsible for regulation and decision making. So when this is off, the regions between the brain have impaired communication. When communication is impaired, issues arise with the neurotransmitters like serotonin, norepinephrine, and our feel-good transmitter, which is dopamine. This means that the nerve cell connection, the synapse, can be lost within communication, and this leads to inefficient communication and mood regulation areas. And this is the cause for our up moods and our down moods when depression is present. Medication management for depression. Medications used for depression are also SSRIs, Prozac, Zoloft, and Lexapro, and these are first-line treatment for to improve moods. Also, SNRIs, and these are Cymbalta and Effexor, but those are just a few examples, and those impact mood and alertness. There is also something called lithium, and this is a mood stabilizer, and it's primarily used for mood disorders and major depressive disorders. It is a second line of treatment when the antidepressants do not work and the disease is more severe in a person's body. How substance abuse affects the brain. Drug and alcohol can affect the brain by interfering with its normal communications, such as neurons and transmitters. Some drugs, such as marijuana and heroin, have chemical structures similar to the brain's natural messengers. This allows them to lock on to natural receptors and activate the nerve cells in an abnormal way. This sends unusual signals through the brain's network. It also causes nerve cells to release a large amount of dopamine, which is our feel-good neurotransmitter. This tricks our body into thinking that our natural transmitter was released, and it floods the brain with an intense high that's actually not real, and this disrupts the normal communication within our channels. Alcohol substance abuse intervention. So there are centers for alcohol and substance abuse, also known as psychiatry hospitals. But if the team sees that a person is deep in their alcohol addiction, then they will send them to something called a managed alcohol program. And this allows them to receive alcohol in a safe amount. But if a person is experiencing withdrawal symptoms, they may be giving opioid agonists such as methadone and buprenorphine. Sorry, I butchered that, as well as alpha 2 adrenergic agonists such as clonidine and lexidine. Thank you guys.